Good afternoon and welcome to our Health's webinar on managing chronic conditions. Having one or more chronic conditions can be difficult and stressful even during normal times. Add a pandemic to that and things start to get even more complicated. Please note that on today's webinar, all attendees are muted. If you have any questions, please use the Q&A in the top right-hand corner of the screen to ask your question. We want this to be interactive, so please ask any questions that you may have, and we'll be happy to answer them during the session or at the end of the webinar. Okay, next slide. Before we get started, I wanted to tell you a little bit about Our Health and your speakers for today. My name is Amber Vandekerk, and I am the Assistant Vice President of Marketing and Engagement here at Our Health. I'm joined today by Dr. Jacqueline Slackoper-D'Alessio, a board-certified family physician at our Yardley, Pennsylvania practice for Our Health. Our Health takes a new approach to primary care. We focus on time, personal relationships, and removing any barriers to care. Our members, we call our patients members, enjoy unlimited access to a personal doctor, both virtually and in person. This allows you the time you need to foster an enduring and trusting relationship. We'll talk more about this at the end, but with your New Jersey state or school health benefits, employees and your covered family members have access to Our Health at no additional cost and with no copays as part of your health benefits. I'm now going to turn it over to Dr. Slackoper to talk to you more about managing chronic conditions during this COVID-19 pandemic.
Good afternoon, everyone. My name is Dr. Jacqueline Slackoper, and as Amber told you, I am one of the Our Health physicians, and I work at the Yardley office. And today I'm going to talk to you a little bit about chronic conditions and why it's important for us to continue to monitor and take care of our chronic conditions, as well as what we at Our Health are doing to help our members continue to stay healthy during this time. So let's start with talking about what a chronic condition is. So chronic diseases are defined broadly as conditions that last 1 or more years and require ongoing medical attention or limit the activities of daily living. So some examples of these would be high blood pressure, high cholesterol, diabetes, arthritis, mental health conditions such as depression and anxiety, vascular conditions, dementia, just to name a few. Next slide. So this slide, we're going to talk about why is this important now? Why is it important to continue to keep our chronic conditions on track? So what we've seen is that 48% of Americans have actually delayed their care due to the pandemic. This is half of our community have put off getting care for their chronic conditions, whether it be due to lack of access, facilities being closed or limited hours, out of fear of going to the physician or reaching out to their physician. And we've also seen that 11% of these chronic conditions have actually worsened as a result of this delay in care. There's also been a study that was recently released by the New York Times that demonstrates the unfortunate impact that COVID-19 has had on thousands of unnecessary deaths that have occurred in our community, not because of having COVID-19, but more because of the near presence of coronavirus and the impact it has had on getting care. So for example, deaths solely from complications of diabetes and heart disease have actually increased by 15% from March to May. So that's a high amount of increase, not just because of having coronavirus, but actually just from chronic conditions. So thinking about this and moving forward, access to care is not only going to be a problem right now, but we're also going to probably see it continue to be an issue as we move forward, as there's going to be this backlog of patients needing to get care from their primary care doctor as well as specialists. Another reason why this is important now is that we know that chronic conditions can actually put us at increased risk for COVID-19. Therefore, delaying care can increase our risk and also complications from chronic conditions. We also know that delaying emergency care for chronic conditions can be life-threatening. And as we talked about, if you delay your care now, primary care and specialists can actually be backed up when restrictions start to loosen even more. Next slide. So this slide just demonstrates 3 of the chronic conditions that primary care providers treat and that we see commonly in the office. And these are diabetes, high blood pressure, and obesity. Next slide. So how can we at Our Health help manage your care and your chronic conditions? So one of the things I absolutely love about being an Our Health provider is our Spruce application. So our Spruce app actually gives you 24/7 virtual access to Our Health and your primary care provider. And this can help us monitor your condition, talk about any issues that you are having, and you can do this by reaching out to your doctor via text message, phone call, or video chat, and a virtual visit through the Spruce application. You can also upload secure photos to the application, and I have members who have messaged me photos of rashes, of their eye, of their throat. And this actually helps us tailor treatment and get treatment done fast, especially after hours and especially during this time during the pandemic. You can ask questions, you can schedule appointments. We do a lot of health coaching through the Spruce application, talking about diet and exercise, as well as medication management, adjusting medication dosages, seeing how our members are doing on medications, answering questions about side effects or certain things that our members are experiencing. Next slide. So what are we doing at Our Health to help manage chronic conditions during this time? So some of the things that we've been doing as we've been partnering with our patients and our members to help keep blood pressure logs or blood sugar logs and checking in with them regularly to see how they're doing. We've set some of our members up with home blood pressure monitors, continuous glucose monitors, to also be able to see values and numbers throughout this time. We've also implemented fitness and nutrition challenges to help keep our members engaged and on track with their diet and their exercise, especially during this time when gyms have been closed. We've been working from home and our daily routines are different. And as we talked about, we've been using Spruce and our virtual tools to be able to do this and check in with our members regularly. Next slide. So as restrictions loosen and we start seeing more and more patients in office, what are we doing to ensure a safe experience for our in-person appointments? So Our Health has smaller boutique style offices, so we have a lot more control over who's coming in and out of our offices and when they are. Our providers have less patients than a traditional primary care provider does on their panel, so we're able to easily stagger appointments and monitor when people are going to be coming in and out. And most of the time, you'll be the only person in the office or in the reception area at a time. We also are able to clean rooms and common touch point surfaces in between appointments, keeping everything safe and low risk. Next slide. So I want to share with you a patient story of monitoring a 62-year-old male with diabetes that's on insulin, and how we have done this through the pandemic and the impact it's had on him. So just prior to COVID-19 and the restrictions going into place, we had just changed up his insulin regimen, literally the week before we went into social distancing. So fortunately, with the help of Spruce and a continuous glucose monitor that he has, we were able to continue to monitor and adjust his insulin regimen throughout the pandemic. So I was able to check in with him regularly via Spruce, usually daily or multiple times a day, to see how he was doing and how his sugars were going and how his insulin number, like what he was using insulin-wise. I was also able to log into his sugar log via the application that's connected to his continuous glucose monitor. And I'm happy to report that we were able to get his labs last week, and over the last 3 months, even though we haven't been able to see each other face to face, he's been able to decrease his hemoglobin A1C by 1 whole percentage point. And in the realm of diabetes, that's a big improvement. So this is just one of the many success stories of how we at Our Health have been able to continue to engage with our members and keep them healthy and on track during the pandemic. I'm going to turn it back over to Amber, who will tell you a little bit more about Our Health, and I look forward to answering any questions that you might have at the end of the presentation.
Thank you so much, Dr. Slackoper, and we can't wait to answer questions that people have. I'm sure they'll have many for you. So I just wanted to follow up to tell you a little bit more in depth about Our Health. So Our Health is 100% covered for you and your dependents and does not impact your existing state health benefits. There are three main principles of our health that I wanted to share. There are no copays or out-of-pocket costs ever to participate with our health. It doesn't matter if you see us once a month, 5 times a month, 10 times a year. However you do that, you're never going to pay anything out of pocket. Another main principle of our health is that our doctors have fewer patients than a traditional primary care physician. So whereas a traditional primary care physician might care for 3,000 or more patients, our health doctors are capped at 1,000 patients. And why does that matter? That matters because you have much better access, more time, same day, next day appointments for urgent issues, virtual access to your our health doctor because they have fewer patients. They have more time to focus on you, and that's particularly important if you're dealing with chronic conditions. Third is you have access to your personal doctor wherever and whenever you need it, not just during the office, not just during office hours, but also after office hours and virtually. And this is even more important now with the COVID-19 pandemic. As Dr. Slackoper mentioned, we do so much with our Spruce application, and this is something that our members really sort of had a seamless transition with the COVID-19 pandemic. And again, particularly if you have a chronic condition, you can maintain closer contact with your physician, both virtually and in person. There is no risk to participate in the Our Health program. You can join at any time. And also, if it doesn't work for you, you can leave at any time, but we hope you'd stay with us. Some people think that you can just join during open enrollment, but you can join anytime during the year. So that's sort of some of the main highlights and benefits of Our Health. If you'll move on to the next slide. I've already mentioned some of the main benefits before, so I'll just highlight a few more here. Again, you'll have unlimited access to your same personal doctor. So we don't have practices with 10 physicians at a practice where you're going to be talking to any physician or seeing a different physician every time. Your relationship is going to be with the physician that you select from Our Health, and you're going to have access to that same physician every time, both in person and virtually. We also offer both same day and next day appointments for urgent issues. So if you have something going on, you have an issue, you're going to be able to be seen, or you're going to be able to connect to your physician virtually if we can't get you in for an appointment right now due to the pandemic. And then finally, you'll also have access to on-site blood work. We offer a 7-day supply of basic medications right at the office and immunizations on-site at our practices at no additional cost to you. So particularly for the medications and the blood work, this is something that our members find to be extremely convenient because it gives them a one-stop shop to go for their medications. If they're sick, they don't have to go pick somewhere else to pick that up. Okay, next slide. And Our Health, you'll see here from our map, has multiple locations throughout the state of New Jersey, from Voorhees down in southern New Jersey all the way up to West Orange in northern New Jersey. So we have physicians who are board certified in family medicine, board certified in internal medicine. They see patients of different ages. Most of them see younger patients and up. Some of them even see newborns and up, as Dr. Slackoper does. So really, we try to make it convenient for all members of your family. And this is available to anyone who has New Jersey state or school health benefits and their covered family members. So you'll see here are all of those locations. So next slide. I also wanted to briefly touch on who is eligible for this program. So this is available to anyone who has a PPO or tiered network plan through the Horizon State or School Health Benefit Program. It unfortunately does not work for the HMO plans or for the high deductible plans, and Medicare retirees are also not eligible for this program. But for all other family members, you and your dependent family members are able to enroll in the plan, again, at no cost, no changes to your health plan, no copays when you come in to see an Our Health physician. Signing up is also extremely easy, and there's 2 ways to sign up. You can go to our website listed here. It's www.r-health.md/New Jersey. I'll repeat that again. www.r-health.md/NJ, or you can also call our member experience line listed here. It's 800-797-1289, and a member of our Health member experience team would be happy to answer any questions or help you enroll. I'm now going to go on to the next slide, and we would be happy to take any questions. So I'm going to turn it back over to Dr. Slackoper on the video. So bear with me 1 second. Okay, and we'll just give it a minute and see if any questions pop up in our chat. Okay, we have our first question, Dr. Slackoper. If you want to unmute, sorry.
Okay.
And that question is, we mentioned virtual access available after office hours. Can you tell us a little bit more about that?
Sure. So through the Spruce application, our members are able to connect with their primary care provider at any time. So this means both during hours and after hours. So basically, if it's after hours, our providers check their Spruce periodically through after hours. So if it's urgent, we still ask our members to give us a call. Obviously, if it's an emergency, call 911. And if you call the office, you can leave an urgent voicemail, and that kind of alerts us to, look at that message right away. But most of us are checking our messages throughout after hours and getting back to you within a reasonable amount of time, depending on the urgency of the matter.
Great. Thank you, Dr. Slackoper. Someone else had posted a question that they're a little nervous still to go back into the office. Can you explain a little bit more about how we're using our virtual access, so that people, if they don't have to come in, maybe they don't have to come in, but also the measures that we're taking for, to ensure safety during those in-person visits?
Yeah, so that's a great question. And everybody's comfort level is different, and it's going to probably vary as time goes on and throughout the next couple of months. So we offer a lot of different ways to connect with your primary care doctor. So we do a lot of virtual visits. We have been seeing members in office, and when we do see them in office, you're the only person in the office. We're doing lots of high-tech cleaning, wiping any touch surfaces down. We're staggering appointments. So there is time in between to do a thorough clean, air out the office, those sort of things. But we offer a mix of appointments. I do some appointments virtually, and then I'll bring the patient in for a quick physical exam, vitals. That way we're not discussing as much in person, but being able to do it virtually so we're not in PPE while we're doing it. So just kind of being able to be flexible and kind of whatever works for the member at that time.
And I think that's something that's so critical. And I'll just add something that I think is so different about our health is that we can take that individualized approach based on what every member needs, because we have less patients. We can take that personalized individual approach, whether that's virtual, in person, or a mix, as Dr. Slackover mentioned.
Exactly.
Yeah. Another question that was submitted, so I'm just reading it here. How do you coordinate care between primary care and specialists to manage chronic conditions? And has that changed at all with the COVID-19 pandemic?
So at our health, one thing that we take very seriously is that we like to set up great relationships with our specialists. So we have really been in touch and trying to find high value specialists to have relationships with so that we have seamless communication between us and the specialist. So we're knowing what's going on when we are referring out to a specialist. During COVID-19, this really hasn't changed very much. Our specialists also have been still seeing patients, maybe a little differently as well, but we're still able to communicate with them and get access to what's going on with the members and just helping coordinate care.
Fabulous. Thank you for that. Someone else wants to know, are we currently doing labs at the office, labs or blood work?
Yes, we are. We are doing labs and blood work in the office. We weren't doing as much of routine blood work up until a couple weeks ago, but we're seeing members in the office for the same procedures, staggering appointments, keeping the time in office limited so that everybody's limited in the time that they're in PPE. And then also, having that time to really thoroughly clean the office in between members.
Great. And I think you sort of answered this with the last question, but there was another question that came in of, what are we doing to maintain a safe distance between the patient and the health guide? We call our medical assistants health guides, when drawing blood.
So yeah, that's a good question as well, because, drawing blood is a little bit more of an up close experience. So obviously our health guides are in full PPE when we're doing it, and we're really trying to limit the time that the member is in the office getting the blood work. So we have everything set up ahead of time. There's not as much talking during the blood draw. Sometimes blood draws, and when we're in the lab, it's a little bit more of a social. We're talking, all of those things, but we're trying to limit that so there's less, risk of spread. But everybody's in a mask and PPE when we're in there.
Okay. Dr. Slackover, I'm just going to ask because I think there's some interesting topics, here, and if this is not a question, but just sort of going off of that, what are some of the other creative ways that we're doing to, for immunizations and things like that, so people can stay safe, without having to come into the office?
Yes, we've definitely had to get creative. And so in my office and some of the other offices, we're actually doing drive-up immunizations. So where we come out and meet the member at their car. So that way they don't get out of their car. They're still in a mask. We're in a mask, but we, do B12 injections, vaccines. We've done some allergy injections, just kind of being creative and keeping members comfortable and safe as well. So that's one of the creative ways that we've come up with to kind of be able to still help and care for our members while keeping social distancing intact.
Great, thank you. Okay, here's another question. Someone just asked, how will we be able to monitor different levels? Will we take different medications for chronic conditions with the current restrictions imposed? And how are we able to sort of keep track of if there's different regimens needed, if we can't come in to do blood work?
So that depends on each chronic condition is a little bit differently in how we monitor. So with blood pressure, as we mentioned, we're doing home blood pressure monitoring, having our members keep blood pressure logs and sharing them with us regularly. Also, blood glucose, same thing, keeping logs and being able to really see what the sugar's doing over time, which sometimes is actually giving us a little bit more insight than just that one hemoglobin A1C value. So I know that I've changed up my approach a little bit too, because I've had to, and also being able to really delve in and see what sugars are doing throughout the day and where we can make improvements. Other conditions, they require blood work to monitor whether it's liver function or electrolytes or blood counts for anemia and iron. So those, we are still doing blood. So we're bringing members in to do blood work with all those precautions. The labs are open as well. So we're still monitoring chronic conditions just in a different way and making sure that everyone is safe and taking the precautions necessary.
Great, thank you. I am not seeing any more questions right now, so I think we will wrap it up there since we're getting close to the end of our time anyway. So thank you so much, Dr. Slackover, for sharing your insights that are so important of, not putting off care, of really trying to continue to manage those conditions during the pandemic so that we don't have bigger problems, 6 months from now. And also just wanted to thank everyone for participating. Just again, as a reminder, if you're not already a member of Our Health, again, you can sign up. You have New Jersey State Health Benefits. You can sign up at www.r-health.md/NJ. And we'd be happy to help you manage your own conditions. So thanks again. And we hope everyone stays healthy and safe during this really challenging time. Have a wonderful day.